The Integrated Management of Childhood Illnesses, or IMCI, is a global strategy developed by WHO and UNICEF to address the leading causes of death and illness among children under 5 years old. IMCI emphasizes integrated care rather than disease specific treatment. Instead of focusing on one illness at a time, it looks at the child as a whole, managing overlapping conditions that often occur together. By applying IMCI, we help reduce child mortality, improve child health outcomes, and strengthen family participation in health care. In the Philippines, IMCI is implemented under DOH Administrative Order number 2001-004 and later updated to ensure national standardization. It supports the SDG goal number 3, which is to ensure healthy lives and promote well being for all at all ages. IMCI is also consistent with the Universal Healthcare Act of RA 11223, emphasizing equitable access to quality child health services at the community and facility levels. The IMCI has three main objectives. First is to reduce death, illness, and disability among children under 5 years of age. Second is to improve child growth and development through early detection and proper management of illnesses. And third, to enhance the capacity of families and communities to provide appropriate home care and seek medical help when needed. Ultimately, IMCI aims to make every child's life healthier, starting from the home, supported by the community and health system. IMCI has three major components that work together. The first is improving case management skills of healthcare workers through training and supervision. The second is strengthening health systems to ensure that medicines, logistics, and referral mechanisms are available. The third focuses on improving family and community practices so parents can recognize danger signs early and respond appropriately. These components ensure that childcare is continuous from the family to the health facility. Why do we need an integrated approach like IMCI? because in real life, children often suffer from more than one illness at a time, such as cough, diarrhea, and fever. Traditional programs treat these conditions separately, which can lead to fragmented and inefficient care. IMCI provides a holistic, efficient, and family centered approach that saves time, reduces costs, and improves child survival by treating multiple conditions simultaneously. IMCI focuses on the most common and preventable childhood illnesses that account for majority of under 5 deaths. These include pneumonia, diarrhea, malaria, measles, and malnutrition. In some regions, it also includes ear infections, anemia, and other local diseases. By targeting these major conditions, IMCI addresses the diseases that have the greatest impact on child health and survival. The IMCI process is a step by step approach that helps healthcare workers assess, classify, treat, and counsel caregivers systematically. The process aims for early detection of severe illness, correct treatment, and appropriate referral when needed. It also emphasizes communication with caregivers because educating parents and guardians is as important as giving medicine. The first step is assessment. Health workers evaluate the child for general danger signs, such as inability to drink, vomiting everything, convulsions, or lethargy. They also check for main symptoms like cough, diarrhea, fever, and ear problems. Also check the nutritional status, immunization, and any other health concerns. The IMCI chart booklet serves as a guide to ensure uniform and accurate assessment across facilities. Once the assessment is completed, we move to classification. This is categorizing the illness based on severity using a color coded system. Pink means urgent referral or hospitalization is needed. This is for severe conditions. Yellow category or classification means moderate illness. The child could be treated at the facility or, if necessary, be referred. Green implies mild illness. The child is advised home care and follow up. This system ensures that children get the right level of education and care without delay. After classification, the third step is to identify the correct treatment. Nurses determine the appropriate medication, dosage, and intervention according to the National IMCI treatment chart. They must ensure that essential drugs and materials, such as antibiotics, oral rehydration solutions, and vitamin supplements, are available. Correct treatment at this stage prevents complication and saves lives. Step 4 combines two important tasks: treatment and counseling. Healthcare workers administer the first dose of medication when indicated, and then provide comprehensive caregiver education. Parents must be taught how to recognize danger signs, give medications properly, and maintain good feeding and hygiene practices at home. Parents must be taught how to recognize danger signs. Aside from that, counseling empowers families to take charge of their child's recovery and prevent childhood future illnesses. The fifth and final step is follow up care. During follow up, nurses assess if the child's condition has improved or if referral is needed. They reinforce preventive teaching such as immunization schedules, nutrition, and hygiene, and document findings for continuity of care. Follow up is not optional. It is essential for monitoring progress and sustaining health gains. The IMCI approach is grounded on several key principles. It is child focused, meaning it addresses the whole child and not just the disease. It is evidence based and cost effective, designed for resource limited settings like ours in the Philippines. It integrates prevention, treatment, and health promotion, ensuring that the family is actively involved in keeping the child healthy. In short, IMCI combines science, practicality, and compassion. Nurses play a central role in implementing IMCI. We conduct assessment, classification, and treatment following the IMCI protocols precisely. We also educate caregivers on nutrition, immunization, and hygiene, and monitor community health trends through data collection and home visits. Nurses are the bridge between the family and the health system, ensuring that IMCI principles reach every home. IMCI emphasizes that families are partners in child health. Parents should ensure complete immunization, proper nutrition, and early child health seeking behavior. They must follow treatment instructions carefully and maintain good hygiene and practices at home. When families are empowered, fewer children get sick, and those who do recover faster. Implementing IMCI brings multiple benefits. It reduces child deaths and overall treatment costs through early intervention. It improves caregiver knowledge and confidence, strengthening the family's ability to care for their children. Finally, IMCI enhances the quality of health services and builds community trust in the healthcare system, a foundation for sustainable child health. Despite its success, IMCI faces several challenges. Many areas still struggle with limited resources, staff shortages, and inadequate training. Some facilities have weak supervision and inconsistent follow up, reducing the quality of implementation. And in remote areas, low community awareness hinders participation. Overcoming these barriers requires continuous training, supervision, and strong support from local health leaders. To summarize, the integrated management of childhood illness is a life saving, evidence based approach that integrates prevention, early detection, treatment, and education. As nurses, we play a vital role in ensuring that each step, from assessment to follow up, is done accurately and compassionately. Effective IMCI doesn't just save lives, it builds healthier families and stronger communities. Always remember, every assessment done well, every caregiver educated, and every child treated right contributes to a brighter, healthier future for our nation's children.